And we're back now. Dane, you mentioned so many things about clinics, but if I should use Toronto and I should use Durham, um, there's one thing I've noticed with sexual health clinics. They always seem to be tucked away somewhere. It's like no one's supposed to know they exist. Like you have to know. I feel like there is this public shame that comes with caring about your sexual health, specifically as people of color. Like, well, just anyone, I guess, because in Toronto, the sexual health clinics that I know about, they're tucked away, like up the staircase, away from a Starbucks. Like they're like very oddly placed, and the doors are sometimes not even labeled. Like you have to know. In Durham, I bet a lot of people don't know this, but there is a sexual health clinic at Pickering Town Center.
Tucked
But
behind the subway.
exactly, it's so weird. Like you have to go where the washrooms are, and you have to continue down, and then you get there. A lot of people don't know that because, and it could just be just coincidence that if someone sees you coming around that corner, the assumption is that you went to the restrooms or the washrooms. Like I would assume that that's the assumption. Is there a public shame with going to sexual health clinics because they seem to be located in these Harry Potter spaces or these Narnia spaces where nobody seems to know where they are.
You know what? The historically sexual health clinics, um, or even just talking about sexuality, talking about sex, talking about reproductive health. There is such a historical narrative and public shaming that comes along with that we do not have time for. That is still such a driver for why we can say go down to the food court, look for the subway, and just keep walking. Or in Australia, or go to when you go to Oshawa. Shout out to Oshawa. When you go to Oshawa Center, go to Kelsey's, walk down, and go up the random elevator to the business area. What's the business area? You'll know when you get there. Just catch up around the corner and out of the way from the general public, because there is still this stigma associated with looking out for one's own sexual health. Uh, Not saying that people's business need to be all out there, but there should be some greater access or accessibility
Mm-hmm.
for um, for community-based sexual health. Now, um, there are still going to be great dissenters, even within our own communities, those that look like you and I. There's still going to be protests, and protests, little demonstrations that go on about um, one's own choice in reproducing. Um, Women's reproductive health is a big deal that, again, don't have the time to unpack.
Right.
um, or even talking about, why are you getting those, why are you looking at those condoms, like big man need magnums. Well, not all black men have penises the size of our forearms. Facts. And so, yes, when people are going to inquire about their sexual health, they're asking a myriad of questions. And until we get to a place where we can be far more open, without needing to be necessarily super explicit,
Mm-hmm.
but where we can be far more open with having these conversations in whether it be at the pharmacy with our local pharmacist,
Mm-hmm.
or downstairs in the church when the nurse comes once or twice a month. When we can get to that place when or where we can be um, continually open and continually educated and educating others,
Right.
we're still going to have our clinics caught up in the corner or hidden in other areas. I don't want to out too many locations, but I do want
Wow.
folks to know that if people need to know where their local sexual health clinic is,
Mm-hmm.
check out the Sexual Health Information Line of Ontario, or Shiloh is what they call it, SHILOH. Google it, and they have community health promoters available that can provide that information right across the province. Where can I go to get tested? Where can I go to get population specific health care? And that piece is really important to share. Just a great opportunity to throw that in. But while we're not sure where to go to look about our own sexual health, we still have the opportunity to call or search for where we can go.
Okay. 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 Thanks for the plug. People, if you're in Ontario, just go ahead and do the Google search, and you'll find all the information you need. Now, you brought up prep, and I wanted to dive into, because this is your field, prep, pep, and ARTs. What are they? How are they different from each other?
Okay, so PrEP, pre-exposure prophylaxis,
Mm-hmm.
is taken typically once a day. Um, the popular brand is Truvada, for folks that may know, and that's taken by someone who's HIV negative, who may be um, in a relationship or just involved in sexual activity, continuous sexual activity, where the risk for HIV exposure may be higher. And
Mm-hmm.
so, what PrEP does, it prevents the virus from replicating in the body, in the event that there's an exposure. Now, PrEP would be taken daily and would be part of just a regular regimen. In order
Mm-hmm.
to access PrEP, or to get PrEP, if you will, one would have to test for HIV, would need a negative test, and would need to test frequently. So right now we're looking at 3 to 6 months. Every 3 to 6 months, where someone on PrEP, so every 3 months, would need to test, just to ensure that they are free from HIV. Um, just a note again on PrEP. It prevents HIV and HIV transmission. It does not prevent sexually transmitted infections.
So it's
Now,
not a
for
magic pill. It's not
it is
magic.
not a magic pill.
Okay, so
Um,
let's say it only prevents HIV. That means that we should be using this in conjunction with a condom. But I mean, most people are going to say, you know what, like if I'm already on like prep, why do I need condoms? Like, can I not just, hope for the best, pray, and go see the clinic a couple of weeks after?
so here's the thing, and then I'll get to PEP and ARTs. The thing with PrEP, though it prevents HIV, um, it doesn't prevent the transmission of other bloodborne and sexually transmitted bloodborne infections. So, be it chlamydia, gonorrhea. Earlier mentioning that gonorrhea is becoming increasingly difficult to treat.
Mm-hmm.
Um, it doesn't prevent other reportable illnesses such as syphilis. Um, it doesn't prevent um, it doesn't prevent other sexually transmitted infections, but hooray, no HIV. Um, so that's why we still encourage, even though um, condomless intercourse with the use of PrEP may prevent HIV, it's still best to be aware that there are other things that are going on, that may be going on. So testing and being able to test whenever possible, that'll be the best defense, your own best defense, really. And when we talk about PEP, so post exposure prophylaxis, so
Mm-hmm.
what PEP is, this prevents HIV from replicating in the body in the event of a potential exposure. Now, this is taken again by someone who is HIV negative, but this is meant to be taken in the instance of an acute exposure. So um, maybe it was um, a sexual encounter where where one finds out that the other partner is HIV positive, or um, potentially has HIV, and PEP can be accessed at most emergency rooms,
Mm-hmm.
um, no charge. What happens is that there's a battery of questions that are asked. Just they go on clipboard, and the nurse will ask a number of questions. So, um, what type of sex were you having? What positions were happening? We in my work we talk about serial positioning, um, but we have these conversations because it helps with assessing potential risk of transmission. And so, what PEP does, it prevents replication on the spot. Important thing about PEP is that it needs to be taken within 72 hours of potential exposure. So if it happened on Friday and you call your local aid service organization on Monday afternoon, really high chance that that anxiety is going to be ramped right up, because 72 hours, like within 72 hours, PEP works the best. So
Mm-hmm.
please, if PEP is necessary and you want to look about it, go to your local ER, your local emergency room, and ask about PEP. Now, ARTs, or antiretroviral treatment. Antiretroviral treatment, specifically for HIV, has been around in varying forms since the early '80s. Yeah.
Mm-hmm.
Um, when when AIDS first hit the scene on a wider scale. Now, early technology was really rough on the body, and in many cases, people were really suffering, and in some cases dying, not so much from HIV, but just from how rough the treatment options at the time were on the body. Now,
Interesting.
since 1996, highly active antiretroviral treatment has been available and has been on the scene, and it's been a real game changer in improving the quality of life for people living with HIV and AIDS. Typically, it's a combination therapy where it's two or three drugs in one pill, or it may be a combination of treatment that one can take during the day, whether it be once or twice a day, depends on the regimen. And what that does, it prevents the body from replicating the virus. Now,
Okay.
HIV is quite the smart virus inside the body, because it'll replicate as quickly as the body allows. Now, again, not all bodies are created equally, so the virus could move rapidly, um, in one, and could be real slow. So when we talk about long-term non-progressors, we're talking about folks that the virus might not, HIV in this case, may not have such a great effect until much later in someone's lifetime. But with ARTs, antiretroviral therapy, what it does is it what ART does, it keeps the T cells at a high rate. So the good cells keep those up and keep the viral load. So the HIV keeps that down as low as possible to, in some cases where we can say they're at undetectable levels, meaning that um, under a microscope or when being sampled, it's really minuscule. So to the point where the microscope just can't detect the virus in the sample. Now, saying that, it doesn't mean that an undetectable means that there's no HIV present. It just means that in this case, when we're talking about antiretrovirals, it's working really well in the body, that the virus has been tamped down to such a place that it's totally manageable and not transmittable.
Okay. 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 Interesting. You said a lot of things there, and like every time you said something, I'm led to go back to a couple of things. So, it's gonna be very sad that I'm saying this, but I don't watch a lot of Canadian cable, but I watch a lot of American content. And one of the things that I see advertised is Truvada, Discovery, and it seems to be marketed to a specific, group of people. Let's use a random name like a Chad. So Chad is a party goer, loves girls, loves to do his thing, hates condoms. Is prep for Chad? Because I've never seen, you know, prep being used or targeted towards heterosexuals. Is it a case where these companies believe that heterosexuals aren't as I guess, promiscuous or non-monogamous? Because polyamorous relationships seem to be a thing now. So, is it a case where there is this belief that only a specific community can benefit from PrEP? Because I've I've never heard of a heterosexual male being on PrEP. So why is that?
It's just that Chad is being marketed as the, if you want to say, the typical heterosexual, probably white, um, male
Mm-hmm.
who has a good time and is in total control of their own health. Now, what if that wasn't the case? So knowing that um, treatment options, particularly HIV treatment options, are typically picked up and marketed mostly to um, gay, bi, and other men who have sex with men. We know this is the case. We are seeing a lot more that HIV treatment options are being marketed to couples, sorry, and to younger people.
Mm-hmm.
But generally speaking, when we're talking about, you know, who and where should treatment options be provided for, and not even just where we're talking about ARTs or PEP or PrEP, but even condoms and lube. And many times it just the same run has to be produced 5 different times to go to different demographics.
Mm.
And it's like, consider yourself lucky, I guess. You don't watch Canadian TV. American TV really isn't that better, just for the record. But there are time slots and there are advertising slots available where treatment options are pushed a lot more to
Mm-hmm.
particular demographics because of the time of the day or even the day in the week. So where it may be um, like okay, so I'll give a show. So let's say Drag Race is on. Chances are Logo or whoever's going to be showing the broadcast is going to a have an advertisement from a pharmaceutical company promoting PrEP or promoting um, new HIV drug because they know that the most eyes that would be most interested are likely going to be watching and seeing that during Drag Race. Whereas if I'm watching Wheel of Fortune at 7 o'clock on a Tuesday and I get some random advertisement about, talk to your doctor about how to get PrEP today, I say, well, what are you talking about? Change the channel or something along those lines. Because again, knowing the audience and knowing who is going to be looking at or talking to and interacting with that advertisement. Now, going back from before, if we as communities and community peoples were able to be willing to have those two-way and fluid conversations about things such as, um, okay, so you don't wanna use condoms, but you wanna do your thing here and there and whatnot, and that's fine. That's your call. But I saw on TV when I was watching my stories where I saw this thing about what is it? Pep pep. What is that? If we were able to have those bits of conversations, we would be able then to go even further to say, oh, okay, let me go to the ER as soon as possible if in the event of an exposure, or let me go to my local sexual health clinic if I have any questions. Let my own social connects know where they can go because we all we're all sexual human beings. Um, if we were able to have those conversations and interact with advertisements and um, big pharma, if you will, in those ways, then
Mm-hmm.
we would be much better in those aspects, and we'd be able to continue to be able to take care of our own communities as we go along the way. So yeah, Chad could be, you know, party boy, straight white guy. Chad could be trans man who's in a monogamous relationship. Chad could be Chad could be anybody. But if Chad is able to interact with Ethel or with Orville to let Chad's friends know about their sexual health options and how to take care of and how to prevent um, just any instances of sexually transmitted bloodborne infections or just any illnesses related to um, STIs, then we would do a lot better. We would be a lot better.
Okay. Okay. That was a lot to unpack. Um, it was a lot. It was a lot to unpack, and again, prep. I remember a couple of years ago there was a black woman actress, female actress, who was kind of upset that prep had existed for queer men for so long and it was not marketed to black women. Now, I
Right.
think in the conversation that we had, I think the largest group of women, of people contracting HIV within the province is that black women. Did I read that wrong? Is that correct? So
Yep.
the fastest.
So what's happening in Ontario
Mm-hmm.
with new diagnoses, um, gay men, so gay, bi, and other men who have with men still drive new transmissions and new diagnoses. Now,
Mm-hmm.
to note, one of the faster growing populations or subpops are women, and particularly African Caribbean and Black women. And so, um, to that concern about, why isn't the information being marketed to Black women,
Mm-hmm.
um, it's a great question. It's a great question. What can we do as communities, though, to ensure that that education and that communication is happening, so Black women and young women and Black gay men and Black trans folks are receiving the information? We need to receive the info as is presented, updated, actual, factual, and put it out there and put it
So
forward.
women can take PrEP,
Women can take PrEP.
but
There is
what?
still information. There's still information and still studies happening with how PrEP works with women, because it works a little differently. Um, the absorption of PrEP works a little differently with women as opposed to men. And so with the advertising and promotion, PrEP initially was, and still is, geared toward um, cis men,
Mm-hmm.
but work is
I'm going to
still
stop you
ongoing.
right there. I'm going to stop you for a little bit right there. I know you've been using cis. I know what cis is, but for people who don't know, what does cis mean? Because people,
Thank you for
I know
that.
like a lot of Jamaicans are going to be like, what is cis? SIS? Like, what is that?
All right, thank you. So, cis or cisgender. So, what that means, it's um, how one's identified, or gender identified at birth, and how one is conditioned, grown up, and brought up. So when I'm talking about cis men or cisgendered men, if I'm born with a penis, grew up at grew up as a boy, growing up as a man, still going through life as a man, and then being asked how I identify it, I'm gonna go with what I know, and that is, in this case, the cisgendered or cis male.
Okay, okay,
And that's
okay.
CIS, just for the listeners out there.
um, I like that you said that. You were so I did cut you off a bit because I wanted
That's
to
okay.
make it clear, because I know whenever I use this term, it feels very like social justice warrior kind of term. So like unless you're in like this social justice community, like nobody really knows what cisgender is or what BIPOC means. So I just always want to be sure that everyone who's listening knows, is kind of aware of what these terms mean. But you can continue.
Yeah. So with the just closing out the bit about prep, um, it's less about why is it not being promoted to Black women more, and
Hmm.
it's more about more work continues to happen, more work needs to be done with regard to prep and how it works um, in the body,
Hmm.
with women's bodies. It's not to say that it doesn't work, because there are women who are on prep, who are using prep. Um, but the marketing as it stands right now, much of it still still speaks to the male or the masculine community.
Hmm. Okay. Okay. I'm glad you were able to say that because it's always been a question. I know recently, someone had sent out this request for women who wanted to be a part of a prep study, and I found that interesting. I wanted to cut it and kind of send it to you because it was exactly what we discussed. That women like prep wasn't be it just wasn't being marketed to women, but now I think U of T has a study that if you are a black Caribbean or African woman, you're able to get into a study which allows them to take prep for, I guess, a couple of weeks, and just to see what the effects of prep on a woman's body is. So it's great that I guess we're trying to get there, but we're just not there yet. Now, I want to close off, and it's been a super long night, and I know you have a lot to do. I know Ontario just opened up, but I used to see this thing U equal U all over the place, specifically in December. And I was like, U equal U, what does that mean? For most people within my circle of black folks, they don't know what U equal U means. So you said that when someone takes ARTs, provided that everything goes okay, they may have an undetectable viral load. Another question is, does undetectable mean it doesn't show up on an HIV test?
It's a good question. So undetectable means that it's untransmittable. So U equals U. Undetectable equals untransmittable, which means I'm going to get to your answer to your question. Um, U equals U for someone HIV positive who is on treatment, who is hooked up to HIV medical care, adhering to their medication, and can achieve an undetectable viral load. What that means is that the chances of sexual transmission of HIV is no, not happening. So that undetectable viral load, the chances of it transmitting to someone HIV negative, low to never. And I'm just gonna say never. I'll say that. Now, does an undetectable viral load mean that if testing for HIV, it's going to say that there's no HIV in the system? The answer is no, because if there's an undetectable viral load showing, means that something is happening in the body. So um, there will be antibodies present, and then that is where, in the context of this conversation, we'd be able to talk about HIV presence in the body.
Okay. So thank you for that. I'm going to ask the question that people want to know. So you meet a girl, she's perfect, but she may have had a rough life prior. She was probably born with HIV. Can you have children? Can you have a full relationship, full sexual relationship? Can you sire children, even though she is HIV positive, or and I'm negative? Can that happen at all without me
Sure.
having to go on something like prep?
Sure. So I'll answer two ways. Answering it directly, yes, um, provided you're not a jerk. If if you're HIV negative, so if you're the partner, the in this case I'll use a mononymous heterosexual relationship.
Mm-hmm.
Male partner is HIV negative. Female partner is HIV positive. Can have a great sexual relationship. Very healthy sexual pleasure can happen during and after. Hopefully, both of you are having great sexual pleasure prior. Um, that's an aside, but um, certainly reproduction can happen. So being able to have sex, have children, have more than one, can happen with somebody who is HIV positive, and women have been able to have um, women who are HIV positive have been able to continue to have children, um, even living with HIV. And now in Ontario, it is not recommended to breastfeed or chest feed if one is HIV positive, just because there's still ongoing information. And again, I'm just limiting it to Ontario in this case. It's not recommended because the virus, while the virus may be undetectable in many parts of the body, the reservoirs in the nipples and the breast tissue where the nutrients, the milk is put through. So vertical transmission is what we're talking about here.
Hmm.
Still not enough information available from an Ontario or Canadian context to say that it is safe to breastfeed if if a woman's HIV positive. It's not
And,
to
and
say that
and
it's not happening in other areas, but it's not recommended in Canada currently.
and just so we're clear, that's the HIV positive mother or the undetectable mother having an HIV negative child.
And that's correct.
Okay.
That's
Okay.
correct.
And if it were the other way around, where the guy was supposed to be positive and she's negative, um, the same thing applies, right?
And that's correct. So, um, guys HIV positive, girls HIV negative, guys on treatment, adherent to treatment, can maintain a low to undetectable viral load, a manageable viral load, and it can have condomless intercourse, to a place where, should they choose and should they want, can have children as well. I didn't note that when I was answering the first bit, but again, should they want, should they choose? Yes, having children is certainly possible. Now, um, for the child, what is the impact of HIV on the child? None, because the child is being monitored. The child will continue to be monitored um, throughout. And no, the mother or the HIV negative partner in this case is tested for HIV and can test for HIV at will throughout the pregnancy and even afterwards.
Hmm. Interesting. Um, I'm not sure if it's serodiscordant couples. I don't know if that's the term.
That is the term.
Um, do you think our community as Black folk, do you think we are there where, you know, do you we're at the place where serodiscordant couples will be a thing, where you will see people dating regardless of HIV status within our own community? Because I feel like, so I had this conversation before about serodiscordance or serodiscordant couples, and girls have said, me, no, no, sorry, yeah, he could be really nice, but that's a no. Like I've heard that, and it could just be my circle of friends, but is the community ready to have that discussion, and do we have a lot of Sarah discordant couples within the Black community, especially here in Ontario?
Sure. So I can't really speak to the numbers because I don't know, but I do believe that we are not even well past, but we as a community, Black people, we're past that point, and we're having healthy sexual relationships because we are having conversations um, with each other as one to one, or whatever our sexual health unit is, where we are having good, healthy, consenting conversations, having healthy sexual relationships, enjoying a fulsome, healthy sexual life. Um, Now, where it gets kind of crappy is when we're talking about having the conversation right across our communities, and
Mm-hmm.
understanding the many sections of our lives and of our communities where we can't even use the word penis, vagina, or breast, right? Like,
See, I
if we're
just did
not,
it.
but if we're not there, then with that community, if with those communities, if we're not there, then having a conversation about, can someone HIV positive and negative come together in a union, even just to date? Probably not. But then that goes, like, what do we need to do? It goes back to the need for continuous health promotion in our respective communities to talk about HIV prevention, HIV awareness. Um, Talking about pause prevention, we call it pause prevention when we're talking about preventing transmission um, among people living with HIV, because healthy relationships, healthy sexual relationships, and 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 talking about healthy sexual pleasure, it really is a whole body thing, and that is where we as a community of folks that look like you and I, we can continue to improve upon, because we are there. We are certainly well past that point where, can we? Yes, we can, and we see that happening time and time again. Um, but we can still improve on just the day to day dynamics of the conversations that some of us are still afraid to have.
I like that. I like that. I like that. Wow. We are definitely going to have you on either a Twitter space or Clubhouse or something to continue the conversation that we've had here, because it's very deep. But we're a little bit strapped for time. So, you know, what would you like people to know? You know, we've had this discussion, we've discussed everything from, other STIs to PrEP to PEP to undetectable viral loads, even discordant couples. What would you like the listeners and the viewers to know?
Sure. So, some key things to know, or to note: not all two bodies are the same. Not not all bodies are going to respond to treatment options, in this case HIV treatment options, the same. Inquiring about one's sexual history, and whether or not they look good, or where they're coming from, when it comes to do I want to get involved with them intimately? Best case would be to look into yourself and to check your own self out, and then be able to have those confident conversations to say, I've checked, and I go to be screened for STIs every 3 to 6 months, because I'm a sexual human being. Would you like to come and test with me? I can show you some places to go. That would lower the feeling of embarrassment, the feeling of nervousness. Have those conversations, but start here first. Start with yourself, and then inquire about other people. It's not to say that you're not going um, to just free will and do what you need to do, but if one's gonna be looking about everyone else, best to look at yourself first. And also, just another note to look about your local sexual health clinics and to find out where they are. Um, and in Ontario, there's a sexual health information line of Ontario. Um, there's also the CDC, the Center for Disease Control in the United States. Um, there are other outlets right across the world, any nation. Take a look and see. If you just Google wherever you are, or just web search sexual health clinics wherever you are, locations, addresses, or at the very least phone number for your local clinic will be made available. And when you go, ask as many questions as you have, because there's a high chance that the person on the other side has that answer for you, or can tap the person that they're working with to get the answer that you're looking for. And then finally, for we as Black people, let's continue to look after ourselves and our communities so we can continue to be great, vibrant, healthy, just amazing people that we are. We're not gonna allow and rely on the data of people that don't look like us to tell us how we should move and perform. We can take hold of that for ourselves and of ourselves. And we need to continue to promote new Black epidemiologists, man. Like, let's get our people leading that data.
For sure, for sure, for sure. Thanks, Dane. Thank you so much for being here. Now, before we leave, we always ask our guests, if you have socials or if your organization has a social, where can we find you or your organization?
Sure. So I'll give a couple of them. For where I am right now, can look up PARN. That's PARN. Can search on what's it, Twitter, Instagram, and Facebook at PARN for counties. Can also check AIDS Committee of Durham Region. So AIDS, AIDS, Durham, DURHAM, just all one word on Facebook, Instagram, and Twitter. Also check out ACDR Youth. They have a really fun social media presence. And um, look for Black Cap, BLACKCAP, and look for them on any of your social media outlets. They are very active in providing resources and information. And with regard to ongoing and updating um, data intelligence, and just the intersex of epidemiologics, bioethics, and data science, look up REDE, REDE, for Black Lives. The amount of content that's coming out from them that is just widely needed for
Hmm.
we all to know, look them up.
Okay, okay. Thank you, Dane. Thank you for being here. And we hope to have you again. We hope to have you on one of our other platforms. But we're at the end of a very, deep conversation. So, as usual, until next time, walk good.